I'd like to introduce to you today Emily Ventura. She's the Executive Director, the co-founder of the PFIC Network, a patient-led advocacy organization that is committed to improving the lives of patients and families worldwide affected by PFIC. She was an ICU registered nurse from 2009 until 2019, until leaving her career to become a professional advocate. She is a mom of a 10-year-old girl with PFIC 2, who had a liver transplant at the age of 5. She's committed to supporting the PFIC community through providing resources, sharing knowledge, and advocating for and with the broader PFIC community. And she's doing a wonderful job of it. Emily is here today, and I'd like to ask you several questions. But the first one is, what is it like to have a child with a rare disease? It's a big question.
It's a loaded question. It's all over the place. At times it's isolating, I would say. That's my first instinct. It's isolating. Until you find a broader community, and sometimes that broader community is very broad, very far away. You don't have any connection point. You don't have others who understand what you're going through. What you're going through is there's a lot of uncertainty because it's rare. So there's a lot to be discovered. There's a lot to know. And oftentimes, unless you're able to share your experiences with somebody else who has experienced that, it's isolating, it's lonely. Sometimes it's hopeless.
How does it affect your family, your relations with people, outside of your immediate family and your friends and all that?
Well, I'm very fortunate. I have a wonderful, supportive community, family, and outside of our family. A lot of times, though, people don't know how to help, but they know that you're going through something. They might not even know what you're going through, but they know that you're going through something. So it's challenging because I'm always the person who's going through something. So it makes those relationships, though we have really supportive people in our lives, it makes those relationships somewhat challenging to keep up with. But again, we're very fortunate to have such support, and I think it's been, I've personally kind of reframed my mindset and just kind of try to focus on that gratitude of the support that we have in others.
Have you learned to really just, to block out things that are not good, and, that you see friends and things like that that are, not the right places to be, for you?
I try.
No, I'm
focusing on myself.
True.
Yeah, in these relationships is not necessarily something that comes natural because there's always so much going on. So it makes it challenging to support personal relationships, but try.
Tell me something from your experience. I know your daughter is the only child that you have, but how does it affect families that have multiple children, the siblings? How does it, when you have one child that has PFIC and the others around them, how does it affect them from what you've heard from other families?
Oftentimes, the child who has, the illness, who's going through that, receives, a lot of extra attention. In PFIC specifically, children are in the hospital quite frequently. And parents are always worried about their child because there's there's just a lot of concern, a lot of uncertainty. So there's always worry placed around the child. And for those parents that I know that deal with that on a day-to-day, there's a lot of, they feel guilty, that they do have the attention focused on the child with the illness, and that they don't give the same attention to the other children. I know that's a very common feeling. I will say that of the the children who have siblings that are a bit older, I've seen a lot of resilience in those siblings. They grow up in this environment where they know that the support is shifted onto their sibling, and they just feel like, they're almost bred to just jump in and kind of help and, be that supportive person in their life. So they become very resilient children, teenagers, young adults as they grow up. But in those moments, I know that there's a lot of guilt with that attention shift.
I'm sure also the children that are sick, that have the illness by themselves, also it's difficult for them too with their siblings as well, I'm sure.
Absolutely. Yeah.
Yeah. So anyway, last but not least, I have one other question that's a little bit more complicated possibly to answer, but probably I think it's the most important. Can you explain a little bit how you built the PFIC network and how do you see the future for PFIC patients? That's a broad, but
Yeah. So I really kind of, I co-founded the network and built the network with a few other parents off of the work that another mother had done early on. So the PFIC network, the website and the community, the scientific community, those relationships had been building before myself and the other parents jumped in and kind of formalized it as an organization. And so I like to recognize that I did not build this myself. This took, a few decades and a few specific people who were willing to step up and try to do more even when they couldn't help either themselves or their own children. But really, once we started building and growing the organization, it just grew off of the relationships that we had as peers, mostly through, we have a support group that's in Facebook. That's where we all know each other from. And so that support group has patients and families in it from all over the world. And so when the organization was created, it was always going to be created with this international mindset. These are the people we're connected with. And so we have to serve all of our peers. And we have a wonderful community.
How do you overcome the language barriers?
So Google Translate is one thing that on a day-to-day is very helpful, but it's obviously not the end all be all. Pretty much in all of our programs, we build in budget to kind of accommodate that. And so with all of our programs, we have money set aside for translation of materials. And then for our webinars, we also have, in the past, we've used closed captioning with a service called Wordly. That's not perfect, but it does help so that, people can see these webinars in real time in their own language. And we're actually exploring more of a live translation service for our upcoming scientific conference that's going to be in April. So we're going to try that out. But basically, it's just, trial and error, first of all. But everything that we do, we have the translation. The fact that our programs are delivered to patients and families all over the world. We have that in mind.
What do you foresee?
It's not cheap, I'll tell you that.
That's for sure, that I know. And how do you foresee the future for PFIC patients with clinical trials, new medications, new treatments?
Fortunately, there is a lot of interest in discovery in PFIC and cholestatic liver diseases. So it's very promising. There's a drug that just came to market to help one of the most devastating symptoms, itching. And there's another one that's in the pipeline.
Yep.
That's available for, another cholestatic disease, Alagille. So there's promise there. And I think, as long as we maintain, an active community and an interest, the interest is there, and I think the development, will happen. I hope that with our kind of international community, we can help connect the science with the patients who could benefit from the science. I think that's one huge potential benefit of having, such a strong international network. And that's one of the big barriers in treatment development in rare disease, right? Is you don't know where the patients are, or you don't have enough patients to support trials. So that's one of our goals is, we have an active community. So, try to connect and bridge that gap.
It's great. Emily, I'm looking forward to keeping on working with you as part of ELPA and as part of our Israeli organization as well, of course. And I'm just looking forward to seeing things move along and to keep giving people hope, the families, the children themselves. And we have to see how we can keep going with this. I think it's incredible the work you're doing.
Absolutely. Thanks, Cindy. And the collaboration with you and with ELPA so far has been wonderful and such an amazing thing. So we're, definitely look forward to continuing to work with you as well.
I'm here. Okay, thank you.
Cindy.